we are looking at the back of someone's shoulder here. Here is our shoulder blade. Here is the humerus, the upper arm bone that does the movement, and together they make a ball and socket joint. The collarbone is also part of the shoulder complex, but for our purposes right now, we're going to focus on these two bones and the motion that we're going through. So this motion is called shoulder abduction, which is raising your arm out to the side. So what can happen is if the rotator cuff muscles are not strong enough or the shoulder blade is not in a great position, we can pinch the ball up into the socket. So we're going to go ahead and zoom in a little bit here. I'm going to rotate it just a tad so you guys can see underneath these faded deltoid muscles. This blue guy here, that is your supraspinatus, that rotator cuff tendon, and you see that there's that ball in the socket. So what can happen is if the rotator cuff is not strong enough, or if there's injury to the rotator cuff, or if the deltoid is overactive, that ball can get pushed up into the socket, essentially pinching this tendon. Now, not only is there a tendon there, but there's what's called a bursa that's there. It's not pictured, but the bursa also sits between that ball and the socket, and it basically acts as a cushion so that you're not going to shear your muscles and tendons up against the bone. But what can happen is that can also get inflamed, further closing down the space for that arm to raise up into the socket. So if you're getting an impingement of the bursa, you're getting an impingement of the rotator cuff tendon, and specifically the supraspinatus, what you'll feel is typically pain that's running down the outside of the shoulder, especially with reaching your arm out to the side as shown here, or reaching out for something with your palm down or your thumb down. So if you're experiencing pain with this, start icing this area. It's going to decrease any inflammation that's getting pulled up into this area. You also want to make sure that when you're reaching out for something, you're reaching out with your palm up or your thumb up. That's going to open up that space just a little bit more. And then we really want to focus on scapular stability, so strengthening the mid-back muscles and also rotator cuff strength as well. The last thing really that you really have to focus on is making sure that there's proper mobility at the glenohumeral joint. So basically the ability of this ball to move properly in the socket. If you're not sure which way you are tight, come and see us. We will definitely help you with that. And stay tuned because we are going to have a shoulder solution series. So we'll keep you guys updated on when that is going to be. So if you're experiencing shoulder pain, ice it, don't sleep on it. That's going to hurt even more. And then you want to make sure that you're strengthening up your mid-back, you're maintaining great posture, we're strengthening the rotator cuff, and we're making sure we have proper mobility in the shoulder joint. Okay, stay tuned, guys. Thanks for listening.